It's my honor and privilege to be invited by Allan to introduce him tonight as the honoree for the evening. I've known Allan for about 8 years now, and one of the principal reasons I'm an Einstein faculty member is because of my meeting with Allan about 8 years ago at the Thruway Diner, which is now since closed, when we had a cocktail napkin designed for the Liver Center, if you might remember. And I think that influenced me quite a bit in joining the Einstein faculty. And Allan's been a great friend and partner over the last few years. And I'm really honored to be able to present this, introduce him today. Allan has a lot of hats. He's the Herman Lopata Chair in Liver Disease Research. He's a professor of medicine in anatomy and structural biology. He's also our Chief of Division of Gastroenterology and Liver Disease, an Associate Chair of Medicine at the Albert Einstein College of Medicine. So he's a busy man, and he comes from an illustrious background. Allan is a graduate of Dartmouth College, where he majored in mathematics, and went on to get his medical degree at Albert Einstein, after which he's had a very long career at Albert Einstein, rising through the ranks in the faculty, with time at the NIDDK and NIH, where he was introduced and met many of the pioneers in liver disease. He's gone on to direct the Marion Besson Liver Research Center, and recently also won the award from ASLD for Distinguished Service, which I think is a remarkable achievement. He has well over 100 publications, has served on NIH study sections, and has led the Division of Gastroenterology and Liver Disease for the past several years with incredible success. I just want to mention a couple of things about the Liver Research Center. A lot of the history of the Liver Research Center at Einstein really is tied to Allan. I don't know if you can recognize him in the back row there, in the third to the last row. I think he had just returned from a Grateful Dead concert, 1977. But the Liver Research Center was started in 1974 by Win Arias, who's here, one of the founding fathers of liver disease. And the Liver Research Center has been continuously funded by the NIH since 1974. It's grown to 35 investigators, a very large group of faculty that have become very prominent in the field of liver research. This is a photo from 2004, which I think was the last year when they had funding for photographs, I imagine. They haven't done any more pictures since then. But the Liver Research Center has become a very important institution nationally, one of only 4 liver research centers in the nation, and has had a tremendous impact on training young researchers as well as developing the frontiers of liver research. Now, when Allan is not in the lab, he's doing lab meetings out in the open air on his yacht, the hepatocyte. And I think this is, there are several versions of the hepatocyte now, this being possibly the latest one. He's also, I would mention, a very important flotilla commander of the U.S. Coast Guard. So I think we can feel safe that our waters are protected by Dr. Wolkoff when he's in uniform. Now, I would mention also that Allan comes from a very prestigious and motivated family. In fact, I would say that the Emanuel brothers have nothing on the Wolkoff brothers when it comes to overachievement. And Allan's 2 brothers, I'm not sure if they're here, Neil and Harvey, are both very prominent in their own fields. Neil was on the cover of Forbes magazine as the head of the American Stock Exchange, and Harvey is a very well-to-do attorney and litigator in the Boston area. I imagine that they'll be prominent supporters of the American Liver Foundation also, Allan. The real brains in the family is Claire, who's also a math major from Dartmouth, and is the principal consultant as an actuary at Buck Consultants. And their 2 kids, Hillary and Steve. Hillary is a psychiatric social worker and also a lawyer, and Steve is an artist in Santa Monica. So I think an incredible family, an incredible career. Thank you, Allan, for all of the work that you've done. And thank you for the friendship over the last few years and the opportunity to introduce you.
Allan, that was incredible. I'm not sure who you were talking about, but he certainly sounds good. And thank you very much. I know you spent a fair amount of time on that. I would like to thank a number of people for putting me up on this podium tonight. My mentor in medical school, who taught me that the liver was important, Win Arias, and Win is here tonight, and I thank him very much. I graduated from Einstein, went off to the NIH, worked with Paul Burke, who amplified that feeling of the liver being important. I don't think Paul was able to make it tonight. But as we go along, I also want to thank the many patients that I've had who probably did the most to teach me about the liver and the effects of what happens to you when your liver does not work. And back when I started in hepatology, we had no treatments. Today we can treat some liver disease. How did we get there? Back in the 70s, I remember just watching patients with diseases that we see more or less cured today: sclerosing cholangitis, primary biliary cirrhosis, and here was I as a junior attending, watching them die and trying to make them comfortable. The American Liver Foundation has really done an enormous amount of work to bring reality, to bring treatments, to bring support to patients. And I think we all need to thank this organization for all that they've done. Among the things that American Liver Foundation has done is to remove the stigma of having liver disease. That is incredibly important. Back whenever you said, my uncle is sick, he's got cirrhosis, and what did someone say? He must be drinking. How much does he drink? Today we know about hepatitis C, we know about hepatitis B, we know all the panoply of disorders that can affect your liver, whether you're a child, as we've seen with Alagille syndrome, or biliary atresia, all the way up to other things. So we recognize lots of diseases. We have treatment for hepatitis C. We have treatment that can maintain somebody in health with hepatitis B. But there's one word in the liver dictionary that I think we need to be aware of, and that's cryptogenic. Okay? What does my patient have? Well, they've got cryptogenic cirrhosis. They have liver disease. I don't know why. Well, it's due to work going forward that we need to discover, take away the curtain from cryptogenic, put a name to it, put a cure to it, put a treatment to it. So this is, I think, my goal, I think the ALF goal, and I hope everyone in this room. So Amy Freeze was asking me, besides giving me an accurate weather forecast that I know she really is good at, she was asking me if her liver was really bigger than her brain. But tonight I'm going to choose another organ. I'm going to choose the heart, and I hope that everyone's heart will open up and enlarge and be bigger than our livers or our brains, and open up your pocketbooks, and really let's try to get up to that $75,000 level. So again, I thank everybody for being here. I'm really honored. I'm really touched. I thank my supportive family. but I thank all of you and hope that the future will be as exciting as the past course has been. And I look forward to cures for everybody whose liver is not working right. So thank you very much.